Assalamualaikum and a good afternoon, everyone. Welcome to RSOG School of Government's 11th webinar in 2021, our 23rd installment in total. Today's webinar is called Evidence in Public Policy. Before we get started, I would like to go over a few housekeeping items and the structure of our webinar session today. To those who follow this webinar through Zoom, please mute your microphones. We are also broadcasting this webinar live on our Facebook. This webinar session is divided into 3 segments. First, we will begin with key questions posed to our guest speaker. Then we will answer questions from participants. At any time during the webinar, you may submit your questions to the guest speaker. Just type your questions in the chat and comment section. Please keep your questions short and straightforward. As time allows, we will address as many questions as possible. Lastly, we will then wrap up this webinar session. This webinar is recorded, and you will be able to access this recording via our Facebook and YouTube page. Without further ado, I would like to introduce our guest speaker today. Dr. Julien Labonne is an associate professor in economics and public policy at the Blavatnik School of Government, University of Oxford. His research focuses on issues of clientelism, electoral politics, and social networks. He carries out field experiments, design household surveys, and use large-scale data sets to test models of voter and politician behavior in developing countries. He has a particular interest in Southeast Asia, with most of his fieldwork taking place in the Philippines. Dr. Julien is also the Blavatnik School of Government Doctor of Philosophy Coordinator. Prior to joining the Blavatnik School, Dr. Julien was an assistant professor of social sciences at Yale and US College in Singapore and completed his PhD in the economics department at the University of Oxford. Dr. Julien previously worked at the World Bank and has consulted for the Asia Foundation, the Millennium Challenge Corporation, and the OECD. He holds master degrees from the University of Oxford and University College London and ENSAA Paris Tech. RSOG School of Government's relationship with the Blavatnik School of Government began in 2016 with a joint symposium on reinventing public service held in Putrajaya. The team from RSOG School of Government that comprised senior officers from the Ministry of Women, Family and Community Development was subsequently invited to present a community-based project in Oxford. More recently, Blavatnik School of Government invited the alumni of RSOG School of Government to participate in a virtual international forum entitled Leading in Perilous Times. Through coordination with affiliate in Singapore, namely Pearson International, the collaboration with Blavatnik School of Government continues today, a webinar with Dr. Julien Labonne. We have 3 questions for Dr. Labonne. Firstly, what is evident in policy making? Secondly, what makes evidence important in public policy making? And finally, what can the government do to encourage the application of evidence in public policy? Dr. Labonne, let us get started. The microphone is yours.
So thanks everyone for being here. I hope all of you are doing well in this kind of weird pandemic time. I was looking at the case data in Malaysia today, and I hope you are safe and your families are safe. But I'm also quite excited to see that Malaysia is rolling out its vaccine program very fast. So hopefully the vaccines can speed up even more. And so I hope it's all going to go well for everyone. The one thing I want to start with is I usually teach on this topic in the Master of Public Policy. So it's a 1-year degree that we have at the school where students have to do a little bit of philosophy, a little bit of economics, and a little bit of this course called evidence, which, it's basically our way of saying, we think data and statistics are important, but sometimes, this might be a bit too much for people. Let's just think about what do policymakers need to practically know to be able to do their job better in terms of how do they figure out whether the policies are working or not, and if the policies are not working, what can they do to change it? So this is this 8-week course that we teach in our Masters of Public Policy. And we've kind of recently with Pearson, kind of transformed that into an online course as well. And so if you think that what I'm saying today is kind of interesting and you want to learn more, we can kind of point you in the direction of some of those online courses where you can kind of delve into the topics even more. So I think that's just the one kind of highlights I wanted to have before I get started. And the other thing is I'm delighted to be teaching you guys at the RSOG School of Government, because I usually teach this when, we used to be able to teach in person, and when, or soon when we'll be able to teach again. I usually teach those lectures in the Thun RSOG Lecture Theatre at the school. We have a Thun RSOG Lecture Theatre, and this is where I teach. And so it kind of feels like there's a nice link here between those two situations. So what I'm going to do is I'm going to quickly share my screen. There's going to be a few things that I might be interesting in showing you at some point. And the other thing I'd like to ask, if that is at all possible, is the one thing that's really nice about Zoom is the ability to kind of reach people quite far and wide. The issue with Zoom is often you don't have a lot of people with their cameras on, and so you're speaking to a screen of names, which is not necessarily the best, kind of most engaging thing. So if you can, that's fine. But if you're in a position to switch your camera on, it would be great to actually kind of see a few. I see a few, but a few more would be great. And I can also, realize whether I'm making sense, so people are a bit confused about what I say. So if you are at all in a position to turn your cameras on, that would be greatly appreciated. So thank you to those of you who are doing it. I just wanted to check. You can see my screen, right? Okay, great. So kind of starting from there. So, I was thinking of the three questions that Jorai asked me at the beginning, and kind of to think about what can I say. And I think what I'm going to do in the next kind of 30 minutes or so is I'm going to talk a fair bit about what I mean by evidence, because I think that's the most important thing. That's going to be about, kind of potentially kind of 10, 15 minutes of the talk. Then I'm going to talk about one example of a recent study. It's not just recent, it's actually an ongoing study that we're doing in the Philippines to try to reduce rates of vaccine hesitancy. And so just kind of a very practical way of how we're using the methods that I'm going to talk about in the first 10, 15 minutes in a kind of concrete problem that's facing policymakers, and trying to see if there's any way we can try to solve that. And then I'll kind of briefly talk about the next two questions about kind of what governments can do to encourage policy. I think if there's one thing that the pandemic has done, is kind of really drove home the point that, evidence is important. We need to know, how many people are currently, affected by COVID, how many people are in hospitals, what kind of treatments can we do to help them. And so I think the need to convince people that we need evidence is potentially, I think, this one thing that we might not have to do as much, but I think we still need to think a little bit, but very creatively about what we mean by evidence and what we can do in practice. So I'm going to talk briefly about, different types of evidence, from descriptive evidence to more causal evidence. Then I'm going to try to kind of flag some things about how do we know if a policy works or not? And then, as I said, I'll talk about an example. Right? And so, just to demystify the term, sometimes it's a bit kind of challenging. What we mean by evidence can be very broad and wide-ranging. So we can have, we think of evidence that can be very, very descriptive, right? So, the most basic type of evidence that a country needs, in a way, is like how many people live in my country, right? So like think of like a census of population as like the main point of a descriptive evidence. So just like how many people live in my country, where do they live, and that could help you kind of target services in a sense. So that's just kind of like trying to understand how many people you have in your country, but also who they are, like trying to measure poverty in a country is going to be it's going to be descriptive, but it's going to be very, very critical evidence, because, if your country has a poverty rate of 10, you're going to want to implement very different policy than if your country has a poverty rate of 50%, right? And so just a kind of a very kind of, in a way, that's just more kind of basic descriptive statistics, if you will, about your country. But we think that sometimes those information are missing. And again, last year when COVID started kind of ripping through countries, like just having a good data on kind of the caseload was kind of critical to understanding, the potential path of the pandemic in a given place. And so just this kind of very, very descriptive information is going to be very, very important. But it also, because not only kind of affects the type of policies government should implement, but it also potentially affects kind of the potential cost of those policies, right? So when last year the Malaysian government decided to have a wage subsidies for firms to try to keep people employed while kind of factories were potentially closing down because of the pandemic, just having a sense of, how many factories there were, how many people were in employment, how many people could be affected, kind of, multiplying all those numbers meant, having a sense of the potential cost of the policy. So those kind of very descriptive numbers are going to be very important in terms of like your ability to kind of ex ante decide whether you can, the policy is going to be important, should you focus, is this going to be an important problem that you need to focus on? And then kind of how can you actually focus on this problem and try to solve, right? So that's kind of the first bucket of the type of evidence that people can think about is kind of very descriptive. And so that's something that we just mentioned briefly because it's something that's important, but it's not something, this is not something that's something that government needs to do by investing in kind of statistical systems, making sure the relevant data are collected and making sure the systems are designed in such a way that, when new issues arise, then, more data can be collected, right? Often when we talk about evidence, we might have something slightly different in mind. We might have something that's more related to the issue of causality, right? What we want to know, in a sense, whether the policies that the government or kind of the programs that NGOs are implementing are actually having an effect, right? And so here we're going to have to think a bit about, what do we mean by having an effect, and also how do we establish whether a policy is having an effect, right? And so this is where the causality part is coming into play. And here, what we're going to think about is, in a way, to know whether a policy is working or not, we're going to need something that's I'm going to call the counterfactual, right? And here, what I mean by this is to know whether a policy is working or not. What I need to do is I need to be able to compare what happens when the policy is implemented to what would have happened had the policy not been implemented, right? So basically, if I was a worker in the UK that was being furloughed last year because of the pandemic, right? Whether or not furlough works is basically a comparison of what would have happened to me had furlough not happened. I probably would have lost my job, to what happened with furlough, which meant I kept my job and I kept being paid, right? And so to know whether a policy is working or not is always going to be a comparison between what happens when the policy is implemented to what happens when the policy is not implemented, right? So at a very kind of basic level, the effect of a policy for an individual, so let's say me being furloughed or not, is the outcome if I receive the treatment, outcome if I receive the policy, let's say my wage if I receive the policy, to the outcome, in this case, the wage, if I'm not being furloughed, right? So it is always going to be, the causal effect of the policy is always going to be a comparison of what happens when I get the policy to what would have happened had the policy not been implemented, right? And so this idea of what would have happened had the policy not been implemented, that's the counterfactual. That is, in a way, there is a parallel universe where the policy is not implemented, and I can actually understand what would have happened to people in this case, and then I can compare those two things, right? So the causal effect of the policy is always going to be the comparison of those two things, right? And so if you want to see it in a slightly more graphical way, if I think of the policy being implemented, in this dark blue individual here, so the dark blue individual is like the person who receives the policy at a given point in time, and then the shaded blue individual here on the right is basically, it's the same person, but in a parallel universe where the policy is not implemented. Right? And the causal effect of the policy, or the treatment effect of the policy, people are going to use different terms, is going to be the comparison of those two things, right? So that's what we want. And in an ideal world, if we could observe those two things, it would be very easy to estimate the effect of the policy, right? Because I would compare what happens in the policy and what don't happen in the policy. The issue is, unless somebody in the room has been able to clone individual or created parallel universes, we actually only observe one person in one of those two outcomes, one of those situations, right? Either I receive the policy or I don't receive the policy. There's not going to be situations where at the same point in time, I receive the policy and don't receive it, right? So in a way, we need this to know whether the policy works or not, we need this counterfactual. But the issue is often we do not observe the counterfactual. The counterfactual is missing. People who do evaluation would sometimes talk about the fundamental problem of evaluation, which is what they refer to when they say this is they refer to the missing counterfactual. The fact that I only observe somebody in the state of the world where they receive the policy or in the state of the world when they don't receive the policy, right? And so that's the big challenge, right? At this stage, often students would say, oh yeah, but there's some people get the policy and some people don't get the policy. Why don't we use those individuals to learn about the counterfactual, right? So, I can say last year, the Malaysian government had a cash transfer to poor families to help them deal with the pandemic. And so why don't we compare poor families who received the cash transfer to not so poor family who didn't receive the cash transfer, right? So that could be one situation. The issue here is something called selection bias. So basically, here, the issue in this case is the fact that people who receive the policy are going to be very different from people who don't receive the policy, and they would have been different even if the policy had not been implemented, right? In the example of the cash transfer I gave you, it was very clear. It was like the cash transfer were targeted at poor families, right? So even before the cash transfer, the families who received the cash transfer were poor, and the families who did not receive the cash transfer were non-poor. And so if once the cash transfer is implemented, I compare the families who receive the cash transfer to the families who don't receive the cash transfer. Basically, what I'm doing is I'm combining the effect of the cash transfer with the pre-existing differences between those two groups, right? And this is something called selection bias. And here I'm going to try to show this graphically. So basically, the dark blue and the blue shaded individual are the same as on the previous slide. So those are people who are like, this is the person, they say me receiving the policy. This is kind of me in the world when the policy is not implemented. And the red individual here is somebody who's not getting the policy. They was not eligible for it and they were not getting it, right? The issue is that if I compare the red and the blue, I'm combining the treatment effect with the selection bias, because basically, even when the policy is not being implemented, the dark red individual and the shaded blue individual were different, right? So those people were different to begin with. And so if I compare the blue and the red, basically I'm doing is I'm combining the treatment effect and the selection bias, right? And so basically this idea that you can learn from a policy by simply comparing people who get the policy with people who don't get the policy is not necessarily going to work, because there's going to be an issue of selection bias. Okay, and so at this point you might be like, okay, so what do we do? Are we doomed? We're not doomed, because there's something we can do, right? Often governments, NGOs, anything you might be interested in, have some power to decide who gets the policy and who doesn't get the policy, right? And so in some cases, not always, what's going to be possible is to basically, if you take a pool of people who are eligible for the policy, what you can do is you can randomly decide some people are going to get the policy and some people are not going to get the policy. You do this through lottery, right? And then what then happens is basically the people who are in this case, and in this case only, in a sense, the people who are going to get the policy and people who are not getting the policy are going to be very, very similar, right? Because I've decided by lottery that some people are going to get the policy and some people are not going to get the policy, right? And in this case, I can track those families or those individuals or those firms for a few months or a few years. And if I observe in the future, I observe differences between those two groups, I can say that those differences are due to the policy being implemented, because I decided beforehand who was getting it and was not getting it kind of randomly. And so those two groups were similar. And so if through time they start to diverge, I'm going to be able to say that that was the result of the policy. Okay. And so basically, if you think about, kind of to recap what I've said so far, one type of evidence that we care about is causal evidence, is to try to understand whether a policy worked or not. To understand whether a policy worked or not, we need something called a counterfactual. We need to know what would have happened to individuals who received the policy in the state of the world where the policy is not implemented. That's the first. We need this counterfactual. In practice, we don't have this counterfactual because we only observe the individual either when they receive the policy or when they don't receive the policy. Right. So that's the issue we face. A common solution, which is misguided, is to use people who don't receive the policy to provide information about the counterfactual for people who do receive the policy. In most contexts, that does not work because of something called selection bias. Basically, people who get the policy and people who don't get the policy would have been different even if the policy had not been implemented. And so this is the main challenge. And so one potential solution here, and this is not always feasible in practice, but when it is, it's potentially quite powerful, is to basically use the set of people who are eligible for the policy and then randomly select some to receive it now and some to receive it at another time later, for example. And then if we do that, then we can compare the outcome of people who get the policy and people who don't get the policy. And from them, we can learn the causal effect because we are comparing two groups of individuals that were similar beforehand and that were kind of basically within they are different because one is being treated with the policy and the other one is not. Okay, so that's basically what I wanted to highlight. Okay, yeah, and so just to kind of briefly, this you might think, this is well and good, Julien, but this is all very kind of it's not very practical. Is this actually working in practice? Can we actually do this? Let me tell you briefly about a survey experiment we've been running in the Philippines to try to understand ways to reduce vaccine hesitancy. So basically, the Philippines is one of the, it's going down now, but it was one of the countries in the world with the highest rates of vaccine hesitancy. And so lots of policymakers were worried about, at the moment, we don't have a lot of vaccines, so it's actually not that important. But as we're going to get more vaccines in the next few months, we might hit a situation where people are not going to get vaccinated, not because we don't have vaccines, but because they are hesitant and they don't actually want to do it. And so there's a lot of kind of talk in the kind of the medical public health literature about, we need to basically emphasize to people that vaccines are safe and vaccines are are effective, right? And so just kind of trying to remind people of those things, right? And so first of all, the question is like, are those messages actually effective? But also, is there a better way, kind of a more positive way to get people to be vaccinated, right? And so there is another strand of the literature that basically says, or maybe what you need to do is you need to kind of get people to think about all the things they're kind of missing during the pandemic and they would be able to do if they were getting vaccinated. So in the context of the Philippines, there was things like, spending time with your loved ones, spending time with your grandparents, spending time with your grandchildren, and kind of have large family gathering that, are not possible due to the pandemic, but if enough people are vaccinated, people are going to be able to do it again, right? And so we set up a survey experiment where we had basically like a different treatment groups. Some people randomly receive, as part of the survey, receive different messages. Some people receive messages about the vaccines being effective. Some people receive messages about getting them to think about kind of those family events. And what we end up finding in the end is like the messages emphasizing the family events that they might be able to go back to once everybody vaccinated are much more powerful at reducing vaccine hesitancy, right? And so here, this is something that, it took a couple of months to design this survey and kind of set up the experiment. And then basically now we have this information that we might be able to use to kind of better target messages in terms of like, if the government is going to go out a bunch of messages in the future, maybe have at least some of those messages be about more positive, things, more, just try to think about all the nice things you can get in the future once everybody is vaccinated. And so that's kind of a simple example of a potentially quite useful use of those methods where you have some data, some people are randomly receiving some messages, some people are randomly receiving other messages, and then you kind of observe how they behave after that, right? And so that's one might say it's quite timely because this is the type of information that we all really care about. So that's basically what we've done, and in a sense, what can governments do to really kind of improve the use of evidence in policymaking? I think I can think of like there's 3 or 4 buckets of things that government can think about. The first one is making sure you have kind of reliable statistical systems where data are collected on a regular basis for a broad set of outcomes that can be used to kind of track the situation in the country and try to better understand what can be done, right? Here, I think there's one thing that usually helps even more is when those data are easily accessible to researchers. So there is one thing where if a government set up as a wonderful data system, but the data cannot be used by anybody else, right? And so I think the more the ease of access with which the ease with which people can access data is often going to be correlated with more people studying policies in a given country, and so there's kind of more evidence being generated about a given place, and so then there's more evidence that can be used in policymaking, right? So this is something that I think more and more countries are trying to make data kind of publicly available. Not always very well, but I think that's one thing that people can do, right? So that might sound kind of quite broad and not necessarily very closely related to your work, but even in your own work, there's your agency or your department or your workplace will collect data, right? They will do things, and just trying to kind of have some sort of like kind of a data gathering exercise about all the data sets that are available in your agency, right? And so just trying to make that kind of understand what kind of data you have, how can those data be used? Because obviously I talked about RCT, but there's other methods to get at the counterfactual, and maybe you have data in your agency that allows you to kind of use some of those methods. So I think that's something that you can do. You can obviously also kind of work with researchers to design studies to estimate the effect of your own policies. So that's something that often takes a bit of time, takes a bit of kind of coordination, but it potentially is quite powerful. And so just kind of set time to do that. And I think there's always sometimes it's not necessarily easy to kind of get matched with the right researchers, but there's a lot of researchers that are happy to work with government agencies to try to evaluate policy. And so that's something that you can try to do. And so if the governments are kind of keen on doing that, just kind of setting a little bit of budget to kind of do some of those studies is potentially going to be quite useful. The final thing that government can do, which is trying to get a bit more before a big evidence, before a big decision is being made, try to kind of see whether you can use evidence or not. And so here the evidence can either come, with government Malaysia, the evidence could either come from Malaysia or it could come from other contexts. And here the thing, and it's something that we cover quite a bit in the course at the school and the online one, is the idea that sometimes you might be in situations where you are implementing a policy that's the first time it's being implemented in Malaysia, for example, but it's been implemented in other countries. And you have studies studying the effectiveness of those policies in some of those other contexts. And basically the thing here is like trying to think quite carefully about whether you think the results from, let's say a study in Thailand would apply to Malaysia, or kind of a policy experimentation in Brazil would affect, would tell you anything useful for Malaysia. And so this idea of like trying to use evidence from other contexts to inform policy decision in your own place is often going to be quite useful. And often this is sometimes the most realistic way of doing things, because it's, if a policy decision needs to be made, it needs to be made next week. It doesn't need to be made in 3 years. Right? And so having the ability to go and kind of find evidence in other contexts and try to kind of make some kind of sensible judgments about whether you think you've learned something from how the policy is going to work in your own context is something that's potentially quite useful. So I think I'm kind of hitting the 30-minute mark. I'm happy to keep going, but I feel like I've seen there's lots of questions coming up in the chat, so maybe it's time for us to be a bit more interactive in a sense.
Thank you very much, Dr. Julien, for the introductions on the topic. What we could gather so far is that evidence is important to policy making, and the importance has been heightened during the pandemic because people want to know whether the policy works or not. and you encourage government to ensure that data is accessible to as many people as possible, and the timeliness of the data itself. Dr. Julien, I read to you the first question that we received from Yuko. Yuko noticed that you use policy and programs in your sharing. Is there any difference between the two, Dr. Julien?
Yeah, so I think, I think people who would do like kind of, we work with government much more closely than I do would probably feel there's going to be differences between policies and programs. I think in the way I think about it, basically what I'm trying to do is I'm trying to understand so if there is either one intervention or a bundle of interventions that governments are implementing, is there a way for us to learn about the effect of those policies or programs? So I use policies and programs interchangeably in a sense of like, this is a set of interventions in a way, something a government does that is expected to affect a certain outcome, and trying to see whether we can kind of, by having kind of some sort of control group to estimate this counterfactual, we can kind of estimate the effect of those set of interventions in a sense.
Thank you, Dr. Julien. The second question is from Amran. Amran asks you in general, do you see any positive outcome relating to COVID-19 policy so far?
Do you think Amran means like the positive effect of some policies that have been implemented, or kind of like more generally kind of COVID leading to?
In general.
So, I mean, I think in general, it's just, I think it's kind of, it's really pointing governments at the need to really make decisions based on some form of evidence. I mean, obviously, so I think there is something there. I think, obviously this is not everywhere, and this is not kind of something that's going to change in every part of government policy. But I think the governments we talk to, they really seem to understand that, like, okay, like, how do we make sure that if something like that happens next time, we have the information in place quite early on, so it allows us to make decisions. Because I think, especially in kind of March, kind of April last year, governments were kind of, they didn't really know this. They didn't have a good sense of the situation, and so it was kind of sometimes hard to make decisions. So I think that's, in that sense, that's potentially a positive way. But I also think there's also more of a recognition of kind of issues of uncertainty. So basically, I think there's obviously we might know things, but we might know them not precisely, but also, we might not necessarily know what the effect of a certain set of policy is going to be, but we might have to kind of make educated judgments about some of that.
The question comes from Shahid, Dr. Julien. He's asking you, what is the difference between technical bias and issue bias in policy? So
I'm not sure I understand what technical bias and issue bias is. Can he or she try to clarify?
Yeah. Shahid, if you can type more on that so Dr. Julien can address it. In the meantime, we go to the next question from Shaiful. Shaiful was asking you about comparative public policy, Dr. Julien. How can other government replicate policy? And what are the factors need to take into consideration when we do the comparison?
So here it's a bit of a challenging question, and it's also going to obviously depend on the type of policies and the kind of the type of context you're after. But I think the key thing is basically, if we think about it, people are going to talk. You might have heard the term theory of change. Basically, the theory of change is like, how do you expect the policy to have an effect? So the government has some inputs, generates some outputs, and then some outcomes that are going to be generated. And some of those, basically, each steps of the way is premeditated on a series of assumptions, right? So set of assumptions being the government is able to implement the policy, but also the set of assumptions being, people using, let's say, resources for the intended purposes and things like that, right? So I think as long as the evidence you're using comes from a context where the same set of assumptions are likely to hold, then it's likely that the evidence from another place is going to be relevant for you, right? So if you need to rely on the series of assumptions that are likely to hold in your context and also were true in the other context, if we find evidence from that other context, and it's likely that the evidence is also going to be true in your own context. So I think that's the main thing. If you start to observe that some of those assumptions might have been true in the other context, but might not be true in your context, then this is when you have to be a bit more careful, and you have to think a bit more carefully about how you think the evidence from this other place is going to be effective in your own context.
Right. I think I go to the question from Abdullah, Dr. Julien, because it relates to the earlier part of your sharing.
Yeah.
How would one identify or overcome selection bias in the planning stages?
So in a sense, it's a bit tricky because like sometimes, we talk a lot about targeting policies, right? We want to target policies to the poor. We want to target policies to certain kind of minority groups, right? And so in the planning stage, sometimes we actually targeting sometimes makes selection bias worse, right? It's basically an issue of like, we want to target the policies to a specific group. And so people are going to receive the policy are going to be different from people who don't receive the policy. So obviously, when you plan a policy like that, then you often realize, there will be selection bias because this is why I'm targeting the policy so widely. One thing to do is often what happens is you might have a policy that you're trying to target to a set of individuals, but you might not be able to target the whole group at once, right? So let's say you want to treat 10 million families, but you cannot treat 10 million families this year. You might be able to treat like 1 million families this year and then others next year, right? And so here in the planning stage of the evaluation, you might decide to say, okay, why don't I don't really have a good basis to decide who's going to get the policy first and who's going to get the policy later. So why don't I just kind of have a lottery, select the families that are going to receive the policies first and select families that are going to receive the policy later, and then basically use that to kind of learn about how the policy is going to work in a sense. So I think this is a way of kind of, obviously the policy itself is going to be targeted, but within the set of targeted individual, then you might be able to kind of decide who gets the policy, who doesn't. The alternative here is sometimes what you do is there's obviously I only had 30 minutes, so I couldn't cover a lot of things, but there's another set of methods called regression discontinuity design. So those methods are often used when there's a clear-cut threshold, and if you're below the threshold, you receive the policy, and if you're above the threshold, you don't receive the policy. So think about kind of a poverty targeting where if your income is below 500 a month, you get the policy. If it's above 500 a month, you don't get the policy, right? So here, what you might be able to do is you might say, okay, there's people with income of 499 and they're getting the policy, and people with incomes of 501 and they're not getting the policy. And so here you might be able to kind of learn something as well by comparing those individuals, because they're very, very similar. Basically, their incomes vary just by a small amount, but some are getting the policy and some are not getting the policy. And so in situations like this, there's other methods one can use to try to estimate the effect of a policy.
The next question from Audrey, which is also relates to your sharing earlier. How do we gather evidence to make an effective policy that is suitable for masses?
That's a good question. So, I mean, I think there's not going to be like a one kind of clear-cut answer. I think it's probably it's a process, right? So basically, I think government can start by kind of gathering more descriptive data, kind of trying to understand how things work, and just sometimes. So I think there's two things, right? So sometimes in government there would be like teams that are going to be interested in gathering evidence, but then they're not necessarily the same people who kind of allocate budgets. And so in a sense, what I haven't talked about at all is kind of the politics of evidence and its use, right? Because the thing is, you might be in a situation where you generate lots of very good evidence, and you know that some policies are working very well, some policies are not working so well. But then there needs to be a commitment to say, okay, we're gonna kind of increase or keep the policies that are working. We're gonna keep doing those, and the policies are not working so well, we're actually gonna stop them, or we're gonna try to change them, right? And so in a way, the policies that are kind of effective for the masses, to take what Audrey is saying, is going to be a combination of gathering the right evidence, but also being willing to act on it. And that's often, not often, but in some cases it might be the kind of the issue, right? So you might have the right evidence, but politicians might not necessarily, or kind of policymakers might not be willing to listen and know. And here, this is where kind of involving people at an early stage of your evidence generation is going to be quite important, because basically what you want is you don't want people to say, well, I don't really like this study, I don't really understand it, I don't think it's correct, because you only go and tell them at the end. But if they've been involved all throughout, they're more likely to listen. And I think there's also a way of framing it. You don't want to frame as like, oh, we found your policy didn't work, you did some bad work. It's just like, oh, this is a very challenging context, it's a very challenging environment. We tried something, it didn't work, it's fine, let's try and do something else, right? I think this is more like a willingness to learn and to change things in a sense.
Dr. Julien, there's quite a lot of feedback here and question talking about emulating policy in other countries. From your experience, can you share with us certain countries that has been doing well in managing evidence, in applying evidence in public policy, which we can emulate, Dr. Julien?
So, I mean, it's a bit of a tricky one. I think I would highlight Mexico. Mm-hmm. So Mexico so basically in the late 90s, they started to do this kind of conditional cash transfer, Progressa, you might have heard of it, and it was kind of evaluated, and it kind of was working very well, and it's still operating at the moment. And so they basically had this system in place, they learned, and since then the kind of government has set up there's basically a law, if I understand correctly, that basically every policy that the government implements need to be evaluated. The rigor of that evaluation doesn't just have to be an experiment, it can be something else, but there is kind of a strong push to make sure that everybody is kind of trying to learn from the policies they implement, and then kind of this willingness to act on it. But I think there would be one case where things are kind of working quite well.
Thank you, Dr. Julien.
Yeah.
I think I'll take two questions together from Fazlo. Fazlo is from Indonesia, mm-hmm. and from Firdaus. Fazlo says that in the current situation, we have limited time to review all evidence, and we need to do things quickly. What could we learn from this situation, and how does we manage all these needs for the evidence? And I link to Firdaus that what should we do if we see the policy that we are doing is negative, is giving negative outcome? So
I think this last question is quite important, because it mm-hmm. kind of goes to the ethics of doing that type of work. Because basically, when you do something like this in practice, what you're doing is you're kind of preventing somebody from accessing a policy, right? Potentially. Mm-hmm. So there is a situation where if you don't have enough money to treat everyone, and then you decide to treat some people or not by lottery, then it's kind of, people will have different ethical judgments based on this, but it might be acceptable because you would not be able to treat everyone, right? In the situations where this is not the case, then you might have to be a bit more careful. And so here, this is where I think social scientists are still learning from people who do medical studies. And basically, in a medical study, you only go and do the study if there's sufficient uncertainty that the policy is working or not, right? So if I know that the policy is working, there is no basis for me to do another evaluation, and so there is no basis for me to exclude somebody from receiving the policy, right? And that is especially important in a situation where the policy can be a medical treatment that has life and death outcomes, right? And so if you have a good ex ante belief that the policy is working, then you don't go and do an evaluation. If you're in situations where you really don't know whether the policy is working or not, then it might be acceptable to kind of treat some people and not others because you're not sure whether the policy is working. Obviously, if the outcomes we look at are kind of things like life and death, you really want to have a system in place that, if you want to find out as quickly as possible as whether the policy is working, because then you can make sure everybody gets it, right? And so I think this is the type of kind of ethical challenges that people have to be facing quite early on to be able to do this properly. And obviously, if you have lots of evidence from other places that the policy is working, then maybe you don't have a good case for you to run another evaluation in your own. You can do different types of evaluation without having to exclude anyone in a sense. And so those are the kind of ethical questions that are going to be very, very important. To go back to Fazlo's question, it's a bit of a tricky one. I mean, obviously with COVID, it was like we need to act fast and we need to have kind of right data. So I think here, just kind of having statistical systems in place so you can actually track those type of kind of some early warning system where you kind of figure out things are going badly, just to kind of get the data, at least get the data early, and so you can act on it. Obviously, there's going to be a lot of uncertainty about the type of kind of outcomes you can reach with the policy, but you can do things like try to implement no regret policies, the type of policies that even if they don't help for this specific crisis, they might have kind of long-term positive benefits anyway. And so just kind of trying to have a broad set of policies you implement to make sure that you can implement those. And also if you have a situation where, try to review whatever you're doing on a regular basis. So if you realize something is not working, and you can change it and do it. And also I think this is a situation where learning from other countries is going to be very important, because basically, especially in situations like this, countries around the world are going to be doing similar things, and then you can learn from what they've done and try to see whether that applies in your context as well.
I read the questions that we pick up from the Facebook of the Julien from Shimi. Shimi argues that one of the biggest criticism of evidence-based policy making is the replication problem. Would you like to share your thoughts on that, Dr. Julien?
So I think what I want to say is, so the replication problem, for those who are not necessarily familiar with it, so there's in a way there's two things. It's like some people do a study in one place and then we try to replicate it. We do it again in the same place, and we don't. The policy the effects are potentially different, or you find a policy working in one context and you're not necessarily figuring out it works in your own context. So I think what I would say is there's two things. One is the more studies you can do in your own context, the better, because in a sense, I think what Shimi's question is also related to something, the problem of external validity. Basically, if you have some evidence from one place, does it apply to your own context, right? If you're already doing the study in your own context, then you can obviously, you're a bit more confident that the results are going to apply to your own context because it's where you've done it. The issues of replication is sometimes the incentives of researchers are not necessarily aligned with the incentives of the policymakers. You might be in a situation where what researchers want is they want to publish their paper, which means it's more likely to be published if they find an effect of the policy. So they might make decisions that increase the likelihood that that's true, which might not be actually would not necessarily happen in a different set of if the policy was implemented at a different time or without the researchers being involved. And so I think here the key thing is to try to do something that's very transparent. So nowadays, what people are trying to do is they're trying to do things like, so they register their studies, they do pre-analysis plans. So basically, before the study starts, they basically say, this is the data we're going to get, this is how we analyze it, and this is how we're going to process the results. And I think that kind of that degree of transparency, in a way, really reduce the issues around replications, because basically researchers don't have as much degrees of freedom, if you will, to kind of do what they like. They just kind of have to, they're a bit more bound by what they agreed before. And so this replication crisis is hopefully kind of going to slowly go away. But if you work with the researchers have incentives that are not necessarily aligned with you. And so you just be careful of that. We might seem nice, but sometimes people don't have your best interest at heart.
Dr. Julien, I pick up a few things from your sharing about the leadership aspect of evidence in public policy making. You mentioned about ethics, you mentioned about willingness to learn. What are other things that important to the people who are involved in this field, Dr. Julien? From your own experience.
So I mean, I think you're right. So I think the willingness to learn is something that's quite important. Also and this is where sometimes the skills you need or the skills you want people to have to do evidence-based policy making, but not necessarily the skills that make for successful life in a bureaucracy. And so this is where sometimes those issues kind of compete with each other. But I think kind of the willingness to learn, the willingness to adjust what you do based on some evidence that you figured out, the willingness to say, we've tried something, it didn't work, and that's okay, and we're going to try to do something else, is not something that, it doesn't necessarily come very easily to people, but I think in the long run, it's probably the best strategy for how well kind of policies are being implemented. And so I think this is something that, working with someone who is like willing to do those things, or at least kind of show an inclination to at least be willing to discuss something, it's something that's quite important. So I think having somebody who's kind of happy to do this, and then kind of, I think in the kind of medium run, it's also kind of quite important to have kind of the issue, I think sometimes, is the fact that there's people who are interested in doing evidence-based policy making in government, and then there will be kind of people outside who are kind of happy to do those things, but sometimes those people don't necessarily kind of communicate, and they don't necessarily speak the same language, or they don't necessarily kind of, somebody in policy in government might not know the questions to ask the researchers, and vice versa. And so I think part of this kind of willingness to learn, or kind of setting up a system in government to do this, is partly having people in government that are trained to be able to kind of understand what is a good study, what do I need to do to make sure that, like, the study I'm thinking about is going to be reliable, but also what kind of questions I should ask if I'm going to go and work with a researcher. And so I think kind of those kind of skills to try to kind of make sense of, kind of, in a way, both make sense of evidence that's being generated, but make sure that, like, when you're interested in doing your own study, try to make sure that the study is going to be of good quality, and kind of questions that you want to ask before the study goes ahead, not at the end. And so I think this is the type of skills that are, like, I think hopefully kind of more and more people are getting those skills. At least our students are hopefully getting those skills. But this is the type of things we're trying to push.
Right. Ladies and gentlemen, we noticed that there's a lot of curiosity about this field, and I'm sure that many of you would like to know about these skills further. Our colleagues, Kathy from Blavatnik School of Government, she will be posting some context here so that you can follow up on the evidence public policy courses that is currently running in PSG. Dr. Julien, last question before we end this program. You are an ardent fan of Arsenal Football Club. Is there any evidence that Arsenal will win Premier League this season?
There is absolutely there's not a lot of evidence that's going to happen. But supporting sports team is all about hope, right? So we just hope for the best, and we do what we can. But yeah, and so just kind of to pick up on what Joy was saying, there's this course that Kelly posted on it. So like the online course is an 8-week course that covers the topics of evidence quite practically. And again, this is the just kind of, it's not necessarily going to make people like experts in evidence-based policy. You're not going to be able to go and run your study, but if you were interested, you would learn the type of things you should keep in mind, the issues that might arise, but also how you can then use evidence from other places to kind of apply it to your context. And then the school has a bunch of other kind of more kind of in-person programs for kind of either future leader or established leaders in government to come and spend kind of a week to 2 weeks in Oxford to kind of work with the faculty on, and kind of other people from around the world to kind of improve how the agencies are being run at the moment, but also, you know, if they're going to do the next steps in their career, what can be done to kind of help them with that stage. So I think they're always happy to welcome people in Oxford, hopefully more easily in the next couple of years.
We have come to the end of the program, Dr. Julien. Would you like to offer some parting words to our colleagues today, to our participants?
I mean, first of all, I'm very, very grateful that, you know, 120 of you showed up on a Thursday afternoon where, you know, during the lockdown with all the things that are happening. So I'm very grateful for that. It's also, you know, I'm very grateful that people are interested in those topics and people want to do more on it. I think that's pretty nice. And then, you know, I hope we can help you do this more in the future.
Thank you very much, Dr. Julien Labonne, for spending time with us this afternoon. We could feel the passion and enthusiasm that you have on the topic. On behalf of the school, we wish you good health, Dr. Julien. We believe that you have a lot to offer to this field, so it can be expanded further. To our participant, thank you very much for taking part today. We value your questions, your feedback. We apologize for any shortcoming. To our colleagues in Blavatnik School of Government, Kathy and Vicky, thank you very much for helping us in coordinating this program. So till we meet again, please take care, stay safe, and keep in touch. Follow us in our social media for future programs. Once again, Dr. Julien, thank you very much. To everyone, Assalamualaikum. Good luck.